I'm a registered nurse in one of the local emergency departments. We have had the privilege of being rewarded a grant to develop a program within our emergency department related to opiate use disorder. The program allows us to be able to network with community resources to be able to place our patients that come into the emergency room that are either withdrawing, detoxing, or that have overdosed. Typically when a patient does come into the emergency room, they get a social work consult and they're seen by social work and provided those resources. With this program now, it allows us to be able to take that extra time with the patient and help make those phone calls and bridge those connections in the community with the patient and that resource. I also lost my brother 2 years ago to an overdose. My brother, was throughout high school, did sports, had good grades. With my family, there was never any history of addiction with drugs or alcohol. My brother had a knee injury and after surgery developed an addiction to the narcotics. That addiction lasted several years, and unfortunately he lost his life December of 2018. Going through that with a family member, I was able to kind of see how, when somebody's struggling with addiction, how it pours out into the family around them. For those of you that know somebody who has suffered with addiction, handing somebody a piece of paper with 15 to 20 different places to call, and actually, doing it while being sober for the first time in a long time, that's, creates a lot of anxiety for the patient. And so with the program that we were able to develop through this grant with community foundations, we can actually spend the time now to sit with that patient at the bedside and work with them and bridge those gaps in that healthcare treatment for them.
I'm one of the emergency physicians at Troy Beaumont Hospital and the now director of our opioid use disorder program. Thankfully, to the grant money that we've received, we've been able to implement proper connection, follow up with patients once they leave our emergency department. We've partnered with multiple groups and programs in the community and been able to tackle some of the social issues that go along with opiate use disorder and the recurrence of use and abuse. Every single ER physician in our department has become X-waivered. We have partnered with multiple programs in the community to schedule and have follow-up with these patients to continue treatment, not only of medications, but also different social factors of trying to get someone a job, trying to get transportation, trying to get it connected with other people who suffer from the same disease. With the funding and with our personnel, we've been able to connect people outpatient and be able to give them, a fresh start or some resources that they wouldn't have if this program wasn't being developed.
For the last 18 months, the entire world has focused on the COVID-19 pandemic, and rightfully so. But the reality is, we still struggle right here in the state of Michigan with the opioid epidemic. In fact, in 2020, over 2,700 Michiganders died from opioid overdoses. We know that health equity is another extremely important challenge for the Michigan Health and Hospital Association, and the opioid epidemic is a perfect example why. In fact, over the last 18 months, we know that the opioid overdose deaths among the white population actually declined slightly, while the opioid overdose deaths among the African American population was up some 20%. We know that the work ahead will be difficult, but fortunately, we have strong partners. The state of Michigan, through the Michigan Opioid Partnership, is now providing new funding for the treatment of opioid use disorder in hospital emergency departments throughout the state of Michigan. We're here to partner with you through the MHA Keystone Center. We encourage you to reach out to us for more information. Thank you so much for all you do.
Since 2018, the Michigan Opioid Partnership has provided funding, technical assistance, and peer learning opportunities to over 19 hospitals through this initiative. Participating hospitals will receive funds to increase access to medication for opioid use disorder and support continued care for patients with opioid use disorder, from the emergency department visit to treatment maintenance in the community. To learn more about the program, visit the website linked below. Funding for this program is made possible by the State Opioid Response 2 grants.
I just want to say thank you to Community Foundations of Southeast Michigan for the generous grant they've allotted us at the hospital to be able to provide these services to the patients and help them make that first step into recovery.